Hi, I'm Chris Duquette, and ahead I will present an overview of solution-focused brief therapy, its origins, basic principles, primary steps, and what it offers clients. Solution-focused brief therapy stemmed from the work of Insoo Kim Berg, Steve DeShazer, and team from the Milwaukee Brief Family Therapy Center in the 1980s. They worked with a host of challenging clients and found that no matter how severe someone's difficulties were, there were always exceptions, or those times when the issue was absent, managed better, or less troublesome. They found that making these exceptions the focus instead of the problem itself could lead to powerful cognitive shifts and behavioral changes. Partners in both work and life, Insoo Kim Berg and Steve DeShazer were not the first to hit on the idea of brief therapy, as opposed to the typical years-long psychotherapy, but their focus on solutions and exceptions was quite novel at the time. With solution-focused brief therapy, the therapy is short, with a focus on simplicity, pragmatism, and addressing the question, what works, rather than the long, drawn-out conversations and interpretations about the problem. Solution-focused therapy utilizes therapeutic conversations to alter the way clients view their problems and themselves by keeping things conceptually simple and taking a positive, hopeful stance. The idea is that clients already have the tools within themselves to solve their own problems if they focus on what would help, scenarios in which they've already done that, and how to do more of it to make incremental progress. With solution-focused therapy, client involvement is key. Solution-focused therapy views the problem less as a pathology and more as a normal condition of being human. People aren't sick, they're stuck. Solution-focused therapy offers a multitude of structured concepts about how we as therapists can best help people make changes in their lives and the basic jumping-off points for therapeutic conversations that can help us get there. The structured concepts are the idea of the client as collaborator and that the quality of the relationship has a strong benefit on positive therapeutic outcomes. It is more pragmatic to focus on future solutions than past problems. What we say and how we say it can shape a person's perception of themselves and their difficulties. Every single client has strengths and resources that can be used as the building blocks of positive change. Change is constant, and problems will ebb and flow, so we should look for exceptions to the problem, where or when it doesn't occur, and build on that. Incremental changes can add up and build momentum. Finally, don't fix what isn't broken, and if something works, do more of it. The major steps of solution-focused therapy are to develop a collaborative relationship with your client. Formulate concrete goals based on client's desire for change. And finally, build solutions from the client's strengths and resources. What kind of client is solution-focused brief therapy good for? Solution-focused brief therapy is a useful model to use with children and adults alike. It can be used for a myriad of disorders from anxiety, depression, drug use, behavioral problems, and more. It's good for communication issues, really any problem or issue in which the client is looking for behavioral change could benefit from the use of solution-focused therapy.